Next, we have our panel discussion diving deep into the fundamentals of whole food, plant-based nutrition and sleep. If I can have to the stage Professor Prabhdeep Kaur, who is from our IISc Center for Public Health at the Indian Institute of Science Medical School. She will moderate the session. If I can also have Dr. Rajeena Shahin, who is the country head for Physicians Association for Nutrition India. And finally, Dr. Sapna from the SCTIMST University Medical School. Thank you.
Good morning, everyone. I was supposed to speak second, but I think because there's a delay in loading the slides. So I'm Dr. Sapna. I am a neurologist. I work in sleep medicine and stroke in Sri Chitra Tirunal Institute, Trivandrum. I started learning about the lifestyle medicine and all recently only. So I am a beginner and I'm also learning. And I've been asked to speak about sleep and chronic disease, the interface. So, first of all, just a background sleep. We all know, I will start with a question like, how many of you got at least 7 to 8 hours of sleep last night? Just give a show of hands. Okay, so maybe 50%. So, that itself shows that many of us are sleep deprived. How does sleep, where does sleep figure in our talk on health? We previously used to think that sleep is a passive process, like you spend your 1/3 life sleeping. But we now know that research have shown that a lot of active metabolic process take place in the brain and the body during sleeping. So, especially we have heard about slow wave sleep, which contributes to our which acts as a housekeeper, it cleans our brain of all the toxic metabolites which occur during our daytime. Then it helps in consolidating your memory process. New synapses are formed, you get the synaptic pruning, new memories are formed and consolidated during sleep stage. There is something called a glymphatic system which removes all the toxic products which are activated maximum during stage 3 sleep. So there is a lot of biological process which happen during sleep in the brain. And when we learn, we all know that there is a change in the pattern of sleep as we age. So beyond 60s and all, you tend to sleep shorter at night and you tend to have a lot of daytime naps. And also the sleep quality decreases. You tend to have more fragmented sleep and easy arousals. You must have heard most of our grandparents telling, I hardly sleep at night. When you see that they are sleeping, but still they feel that they feel unrefreshed in the daytime. So many of these are a part of physiological process of aging, which we are understanding now. And many of that can be part of disease process also. So where the physiology ends and where the pathology begins, still it is an open question which researchers are working on. Then, recent data suggests, like especially large population studies suggest that what we thought happened in 60s and 70s actually start in 40s and 50s. So midlife changes in sleep as well as health are more important because most of the time these are the changes that trigger unhealth in the later age. So these are some of the things that we understand more as we learn about sleep. Then when we are sleep deprived, we all know the acute effects. You can't concentrate well in your classes or your work. You tend to sleep off. But it has a lot of implication the cellular level as well. I don't think to this August audience I need to explain because many of you know much more than me about the changes which happen at the cellular level with aging, senescence. Many of these are reported with sleep deprivation also. And regarding the interface with the chronic diseases, so we know that many chronic disease, especially diabetes, osteoarthritis, respiratory diseases, stroke and all have an associated sleep dysfunction. So whether the sleep problems started these issues or that whether they have a bidirectional relationship. So you find that many of the chronic sleep problems like insomnia, sleep disordered breathing and all, they have an increased tendency to develop vascular diseases, cancers and all, whereas the patients who have diseases tend to have more of sleep problems as well. So that is an ongoing research, and a lot of studies are coming up whether interventions in sleep can help in primary and primordial prevention of these diseases as well. Then another thing I just want to touch upon before concluding is what our Indian research shows us about sleep. So we usually previously used to think that these problems are more in the developed country. It's not so. In large studies like LASI study, that is longitudinal aging study of India, we have data to suggest that in the people above 45 years of age who were followed up, they found that sleep problems are seen, chronic sleep problems are seen in 12 to 15% of population, and this is true in rural as well as urban population and men and women. And it was found that in the Chinese studies on longitudinal aging and repair studies, so they found that multimorbidity, that is one thing that we often learn about, somebody who has 3 or more morbidities like diabetes, stroke, or cardiovascular disease, osteoarthritis, and all, so they tend to have a lot of sleep issues. And this affects their quality of life as well as long-term survival. Then before concluding, just a few solutions. Like this is something that all of us have to think about, and I hope there will be more discussions at the end of this. So what are the possible solutions that we can think of? So one, definitely, as in lifestyle medicine, the lifestyle changes, which include changes in sleep also. So better sleep hygiene, which has to be started. Okay, I will finish this. So, better sleep hygiene, which we have to start at a school and college level. You can't wait for somebody to grow old, become 60 or 70 to inculcate these habits. So, you have to catch them young, make sure that they have a proper sleep, which is continued into adult life as well. And other things, the multi-morbidity management, like in midlife, if you manage these multi-morbidities, future complications due to these as well as sleep problems may be reduced, but these are things that need to be studied further. And other thing, environmental aspects. We all have learned about climate change, noise pollution, all these affecting our sleep quality. So more legislations regarding these is the need of the hour, so that residential areas have more safe zones for people to have healthy sleep also. So I think the rest of that we can hopefully cover in the discussion. Thank you.
May I request you to yes, just rise it up. Yes. Thank you so much. Dr. Samuel has already shown some of the studies, which is basically showing how lifestyle intervention can kind of even reverse disease, not even prevent disease. So I'm just going through a little detail about it. It's focusing on whole food plant-based diet, the larger component of lifestyle medicine. So one of the components of lifestyle medicine. So this is basically, he has already told about Framingham study. So what is the outcome of Framingham study? The first study actually just talked about total fat, right? Later on, we came to know that not the total fat, it is the component of fat which is more dangerous, saturated fat. And, the study is ongoing. There are more data coming in, which is not restricted to saturated fat. It's also going beyond, refined carbohydrate and processed food and stuff. So and then we have nurses health study, which Dr. Uh, Samuel has already discussed, but I think I'll just focus on the dietary part of it. Again, you can see that nurses health study, the next coming healthcare follow-up study, all these studies are done in Harvard, and they have huge nutrition research related network there. Here you can see that nurses study also is proving that saturated fat rich food, red meat, processed meat, thing is bad for human health, not only causing cancer and CVDs, but whereas on the other hand, the diet which is rich in whole foods, which is predominantly coming from plants, which is whole grains, legumes, nuts, seeds, vegetables, fruits, is really protective against these diseases. Some of the cancers which is extensively studied there are, that breast cancer. It also came because of the association with contraceptives. That was the first study. It also studied about colorectal cancer. You can see a lot of data came out. And next one is These are all epidemiological studies. The initial stage of our study, the nutrition study is basically epidemiological studies, long-term observational studies, multiple cohorts, maybe some of them are cross-sectional studies, till 80s. So you can see the Copenhagen study, which is Denmark, which is major. So Copenhagen study was basically focusing on the exercise part, but they also came to a conclusion that food which is high in whole food, plant-based eating pattern will be more productive. But there was a controversy regarding dairy because it showed mixed result. Then you can see that China study came into the picture. How many of you read about China study or watched the documentary or heard about it? Very few. All our lifestyle physicians or associates. So China study is basically done by Dr. T. Colin Campbell, one of the greatest researcher of that time. Even now, he's 90s. One of the conferences I had an interaction with him. So he came up with an extensive study in China, which actually is experiencing a lot of cancer cases. And from 80s to 90s, a book came, which is in 2005, which is about China study. The term whole food plant-based diet was termed by T. Colin Campbell. And his study predominantly focused on China's rural, I think 65 counties, 139 villages, and they found out 350 parameters were taken in as health and dietary. And they found that people who are consuming animal products were highly prone for metabolic diseases and cancer. Many of the cancers, again, colorectal cancer, stomach cancer, even non-smoking lung cancer. And casein, that till that time, dairy was like low-fat dairy was okay, kind of a thing, but he came up with the conclusion, his team came up with the conclusion saying that casein from dairy is also really causing cancer because he has previous animal studies which was done on that, which is showing that animals fed with casein there was a 20% increase in tumor growth, the animals which were having tumor already. Then they put the animal to 1 or 2 weeks of non-casein or 5% casein or a dairy thing. Actually, the tumor regressed. So there was already an animal study proof, which they have actually done it in humans, or they have analyzed in humans. So casein has shown a strong correlation with cancer. So that is something which was breathtaking research in lifestyle medicine. We all actually consider him as a major pioneer or stalwart in the field. Then you can see healthcare professional follow-up study. The NHS study, the nurses healthcare study was mainly done in women. So they have included men also here. Same findings, predominantly plant-based diet, whole foods, not processed meat and processed food, is actually helping people live longer, healthier, preventing diseases. Then another stalwart in the field. How many of you heard about Dean Ornish, Dr. Dean Ornish? Yeah, at least some names are there. Good. So Dean Ornish is another stalwart in the field. He has done multiple studies. One of the studies is the earliest study, randomized control trial. He has 48 individuals with heart disease. He has analyzed and found out that people who are following healthier plant-based diet were having lesser incidence of secondary events, or they have more protective. But he went on for multiple studies. He is one of those ones, he has done his focus to longevity research. So one of the things which, two of the researchers which he has done recently, maybe 10 years, 15 years back, one of them is with Elizabeth Blackburn. Dr. Hansdale has already mentioned about her, the telomere effect. So she has, one more minute. Okay. So he has done 2 studies. One is with prostatic cancer patients and found out that people who are following a plant-based diet, there is 70% regression in the cancer thing. And also there is, I think it is 5 years follow-up. They have shown that there is 10% increase in the telomere length, whereas people who are not following an omnivorous diet were having 3% decrease in the telomere length. So there are multiple studies going on. I'm not able to finish up these things, but what I'm saying is, following these studies from 2020 onwards, if you look, there are tremendous number of studies, huge number of studies which is coming in whole food plant-based diet, not only for reversing and managing diseases, but also for longevity, health span and stuff. So we can share these slides and you can have a look at it. So there is not much time. We can sit for questions. Thank you.
Am I audible? Yeah. Okay. Hi, I'm Prabhdeep. I work here at IISc. My background, I'm a physician epidemiologist working in chronic diseases for last 2 decades. So I think very interesting you have set this conversation, and I will not ask too many questions because I would like audience to interact, but just to set the context. Um, I think in Indian context, and maybe we'll first start with the sleep. What do you think? You mentioned that LASI study. By the way, LASI study will be presented on day 3. That's our one of the opening talks on the day 3. I really encourage you all to attend. But you mentioned that there's data on 15 to 20%, you said, prevalence of 12 to 15%. So that seems to be quite big. But do you think that we have good quality data to sort of set our research priorities in the area of sleep? That's my first question. And second, if so, do we need more sort of exploratory data to understand the sleep problem, or should we be focusing on intervention studies, which can actually sort of help us understand what is that we can do to increase the sleep quality or quantity and the overall impact on health? And I think you may want to sort of mention a little on the age group context, because the younger people, there's a lot of data that they spend time on devices and hence the sleep is disrupted, versus the reason why older people have poor sleep may be different. So the intervention may be quite different as well.
Yeah, that is a very important thought process actually. We like the last year, it was good to learn that it will be presented in detail. So I also went to the site and got a limited amount of data from that group. So there they have mentioned that they found in the 2016-17 that year cohort, they found that the prevalence of sleep disorders was about 12 to 15 percentage, which is pretty high if you take a whole population with more than 30,000 participants included in the study. But such robust data is missing from India. We had a group from Mumbai as well as Delhi who did population-based, community-based studies on sleep-disordered breathing, but that is slightly older studies, like that was done 2 decades back. So there they have found the high prevalence of sleep-disordered breathing in Delhi as well as in Mumbai. Because in that was a time when the NCDs started rising in India. So that is probably a data which needs to be learned further in the coming decades, because we are sure that we have more understanding on diabetes and hypertension now. We know that we are not behind West in prevalence. Maybe we are ahead of them in the prevalence of diabetes in India. So probably most of these disorders are much more than reported in the literature. So we need good quality data. But I also agree that with the limitation resources and need to move fast, because our population is aging faster. So, and we see a lot of complications of metabolic diseases in the 40s and 50s as compared to Western population, where we see, like if you take a prototype stroke, like ischemic stroke, the mean age reported in Western literature is between 60 to 70, like around 67. Whereas in India, consistently all the studies, including hospital-based studies as well as population-based studies have shown, registry-based studies have shown that our mean age of ischemic stroke is in the 50s, actually around 55 to 56. So that is a good 1 decade earlier than the Western reported literature. So good quality intervention studies along with the observational, like along with these studies are the need of the hour, because we need to catch up with our aging population. And yeah, so.
Thank you. I think that's very helpful. And one question from you, and we'll take a couple of questions from audience. I think there's a bit of delay in starting because of the tech problem, so I think we should give time to our speakers. So I think my question to you is again Indian context, right? Whenever you talk about plant-based diet, quite often people say, "Oh, we are a vegetarian nation. Why should we be worrying about it?" Would you like to throw some light? First of all, what is the difference between plant-based diet versus vegetarianism? Secondly, again, are there any priority research question that need to be answered, or we should just be moving to interventions? And we already know, and so we just go and do it, or do we have questions to be answered? And if you
Yeah,
can be
both
quick, so
actually.
we'll take few questions
Thank
from
you.
audience.
Yeah. Thank you. I
Yes,
think
I'm here. So, okay?
Can you please wait?
Sorry, sorry.
Okay, so I think the first doubt is plant-based diet, whole food plant-based diet in this context. The whole food plant-based diet is basically something which is rich in, you go towards more of whole foods, primarily from plant-based sources. So plant-based sources, then it does mean that dairy is out of the picture. Okay, but in the Indian context, when you look at it, we are a vegetarian nation, but the way we eat is really, need to be thought about because, we are the diabetic capital of the world. The NCDs are going high. So there is something we need to do about it. The vegetarian food which we consume are not well balanced actually. It is very high in refined carbohydrate, white rice, white oil, dairy. And one of those conferences of PAN, which we went to Rajasthan, and Rajasthan and Gujarat, we were looking at the consumption pattern of these states, some of these states actually. So the dairy consumption in these states, we were just randomly talking to a few people, and they're consuming 5 to 6 servings of dairy, which increases their saturated fat consumption to 38 grams on an average, which will actually put them into a higher risk of cardiovascular disease and other inflammatory stroke. And the other question, so in the right now, we are all looking for Caucasian data because we don't have much, even observational studies in the Indian context. Whatever is done is basically focusing on the vegetarian thing. We definitely need long-term observational studies, like a cohort study. One of the things which I was proposing any students and researchers here is PAN has around 200 plus doctors who are following whole food plant-based diet. If we can do a cross-sectional analysis, which includes the metabolic parameters, inflammatory parameters, and anti-aging parameters, it would be a great study to start with. We are starting another study with ICMR in collaboration with ICMR for diabetic intervention using again an RCT, omnivorous diet, plus an WPB for diabetic reversal or partial remission or complete remission. So we need a lot of studies in the Indian context.
Thank you. We can take a couple of questions from audience. I request,
Yeah.
please, at the back. Keep your question brief,
Yeah,
sir.
yes, yes, very briefly I'll ask. I'm Jairam, I'm an organic farmer. Much about told about food, really appreciate. But we see there's a tremendous change in last, every year is changing. The food is coming mostly from the factory now. And we are talking about vegetable, fruits, all these things, original food. But the available food available in the market is totally contaminated and is chemically, all those things are happening. So what is that? Is there any study between the original food, what was available about a few decades back or even 10, 15 years back? Every year is changing. Now the old food is coming from the factory food.
Sir,
So
what is
what
the
is that?
question?
That's the one question. How it is? How do you address this question? Because vegetables, all those things, people advise us to eat all those things, but it's contaminated by chemicals.
Okay.
So that's one question. And I got one question for that, madam. And with the market, we get lots of tablets, melatonin sold, and the advice is no side effect, nothing you can consume, you can have healthy sleep, all those things. What
Thank
do
you,
you
sir.
say about that?
Yeah, thank you, sir. Basically, this is one question which we always get in all our conferences. Actually, when you're asking people to eat more vegetables and fruits, one of the major questions, pesticide contaminated, actually. So the answer which we give, we don't have a complete answer, but the answer which we give, and we are working towards it. One is actually like there is a study, it's a nurses study, sub-study, which was done around 5,000 population, which was done with people who were consuming vegetables laden with some pesticides, and the people who were completely carnivores who were not on vegetables and fruits. I think 5 years or something study shows that people who are consuming vegetables, even with the traces of these organophosphorus pesticides, having higher levels of health in terms of their lab parameters for multiple of these metabolic markers, even aging parameter, compared to the ones which is not using. I'm not saying that you use pesticide-laden vegetable. We need to have more regulations around it, actually. PAN is actually working towards it. We are working with FSSA and other things, yes.
So, sir, you asked about the melatonin, and there are some countries where it is marketed as over the counter. Without prescription, you can get that. So, but still, like For improving sleep health, it is one of the medications which is found to be useful to improve sleep, and it's a natural plant hormone in the which is synthesized in the brain also. But as a physician, you cannot recommend using it indiscriminately, because you have to be seen by a doctor whether it is required or not. It has to be assessed before just taking it over the counter.
Okay. Yeah, quickly. Very, yeah, very brief. I came here to learn more about myself, Diksha. I am representing Project Serotonin. I look at the diet and lifestyle strategies to improve health. So for sleep, I wanted to ask how nutrition can improve sleep, and because tryptophan is a very important amino acid that is regulating the sleep, so whether protein is important or carbohydrate, because there are studies that even complex carbs is important, especially in the evening, to improve sleep, especially the deep sleep. So connection, just highlight that. Thank you so much.
Can I
Thank you very much. In 2021, Reddy et al. Published a paper showing that Indian infants and young children get on average 1 hour of sleep per night less than their Western counterparts, which is 30 to 45 minutes lower than the lower range suggested. In 2019, Singh et al. Did a 13-country study and demonstrated that the average bedtime for young children and infants in India is at 10:30 at night, which is 2 to 3 hours later, which translates into getting less sleep at night than their counterparts. Question. All these children seem to grow up and do remarkably well. Do we need, number one, do we need to have Indian-centric recommendations on sleep? And or is this part, getting less sleep in infancy and childhood contributing to my NCDs later in life?
can I just add to that?
You can ask questions in the break because we have more talks. You can
So that's a very relevant question. But I think we are yet to have answers, because what we see now in the decrease in the sleep in childhood may have its effects maybe 30 or 40 years later. So at present it will be difficult to answer. But one thing I can tell you certainly, in like at least this is not a scientific backed data. In previous, before the era of television and devices, Indian sleep time also, children's sleep time also used to be much earlier. So we also, as children, we used to sleep at least at 8:30 or 9, but that has been delayed because after the onset of television as well as device. So diet question, there is many of the neurotransmitters which are involved in sleep definitely have are boosted by some of the dietary factors. But I think this is a evolving area of research where we don't have an exact answer which diet will be the best suited for best sleep.
Can I add?
request others to ask questions in the break. And yeah, you want to make any
Yeah,
last
basically, like lifestyle medicine, like we have a course in that. Actually, there are some few studies which is compiled, which says that one of the things about diet is a high carbohydrate diet just before sleep, 1 hour before sleep, it interrupts the sleep pattern. And yeah.
Okay,
Yes.
no more questions and comments. Yeah, we are going to wind up with this. Thank you very much. It was very interactive. I know you all have lots of questions. Please meet the speakers in the lunch break, catch them, don't let them eat, and don't let them sleep. Thank you.